so you definitely see a lot of patients with low back issues. So what do you think would be, you know, what's
Yeah.
causing them to have those
y-
um, those issues or pain in the
Yeah.
lower part of their back?
Well, it's a funny thing. It's going to sound a lot like our other podcasts, but we're going to say either extreme. Life is kind of this beautiful bell curve. And if you're on that part of the bell curve where you
Mhm.
have enough movement to relaxation ratio, you're going to feel mostly fine. But if
Mhm.
you are overactive on this end of the extreme, you're going to run into problems. And if you're underactive on the other end of the extreme, you're going to run into problems. I
Mhm.
think for most people, we're going to boil it back to more of them are underactive. So I know we're guilty of it right now, but look at
Mhm.
us just sitting here, right? And
Mhm.
so sitting is probably by far the number one cause of us having low
Mhm.
back issues and lumbar erector tension.
Mhm.
And then you kind of mix that in with people not only just sitting, but then chairs that don't have good ergonomic support. They're sitting with kind of crummy posture like this while they're
Mhm.
on their phone and then bringing their neck down to further add tension to the low back.
Mhm.
But definitely by far the lack of movement, and that's sitting as well too. A lot of people don't really slow down to think about this enough, but even if you're sitting in a good erect posture and you've got, your ears over your shoulders and your shoulders over your hips,
Mhm.
and you keep the hips where they are and you come up from that position,
Mhm.
sitting is actually equivalent to being bent forward. And so
Mhm.
then that's keeping that tension load on the lumbar erector muscles. It's
Mhm.
keeping the compression onto the lumbar disc, and it's just
Mhm.
kind of setting up the mechanism of having low back pain. But
Mhm.
that's kind of on the underactivity part. Do you care to sort of take more on the other end of the extreme?
Mhm.
Like, what sort of patients or clients do you see
Mhm.
that come in and maybe have some low back issues due to
Mhm.
overactivity?
Yeah, well, it's kind of like the weekend warrior
Mm-hmm.
kind of a thing, or oh, I've just got to go shovel the snow, and then it's like suddenly you're adding a lot of load into that forward bend
Yes.
um, position as well. So then then your body has, it does its best.
Yeah.
I guess, but there's a good chance that you're gonna tweak something, or because it's not, you know, properly, the muscle isn't properly stretched, and um, doesn't have the good circulation
Hmm.
um, in that area, and it's asking more of it than it's kind of used to,
Yeah.
I guess.
Yeah.
So.
I think the word that I'm plugging in my mind, and I didn't want
Mhm.
to interrupt at any point, but
Mhm.
deconditioned, right? So if it's
Mhm.
not either warmed up properly or it's just not used to taking that kind of load, you don't have the
Mhm.
proper conditioning in your
Mhm.
abdominals and your core, that the low
Mhm.
back ends up paying the price for it.
Mhm.
Yeah, definitely snow shoveling. For those of us that maybe heat with wood around here or coal, because I know that's
Mhm.
not an uncommon heating source in central
Mhm.
Pennsylvania. Picking up those loads or even the wood pellets, like
Mhm.
just a lot of lifting that we have to do in the winter season.
Mhm.
And then again, we kind of get into that point
Mhm.
of we're about to get into
Mhm.
4 straight months of cold where people aren't
Mhm.
going out and getting their walks and
Mhm.
keeping their low back limber and loose, and
Mhm.
a lot more kind of sitting on the couch eating popcorn and
Mhm.
having movie nights.
Yeah.
Not that I'm
And then,
against that, but
yeah.
recognize that that's going to play into the lumbar erectors getting
Yep.
tense and some of the low back pain popping out, right?
Yeah. And then at the other extreme that you're
Yes.
alluding to,
Hmm.
something that I hear a lot is somebody who, for example, does a lot of deadlifting,
Absolutely.
and
Yep.
and they'll say something like, "Yeah, I used to lift a lot heavier, but now I'm
Hmm.
realizing that um, when I do that, it's causing this pain in my low back." So,
Yeah, right.
um,
Yep. So weightlifters
Mhm.
with deadlifting and squats. I know we're
Mhm.
not really in baseball season, but it's going to be spring before you know it. So
Mhm.
too much of a repetitive swing one way.
Mhm.
Baseball players, golfers, once the weather
Mhm.
gets nice. Speaking of the weekend warrior,
Mhm.
once we get that first really nice day in March, a
Mhm.
bunch of people are going to go hit the golf course and we're going to get calls about sore backs because
Mhm.
they don't have that flexibility and strength in
Mhm.
their hips
Yep.
from kind of falling into passiveness in the winter months, right?
Mhm.
So
Yep.
plenty of causes of pain. I hope we
Mhm.
illustrated the point pretty well
Mhm.
for everybody listening to the
Mhm.
pod.